We have Tim Huckton here, who I've known since the beginning of my world at UW and ACA, but I've actually known ACA for about 15 years. So I'm an old head in ACA, but ACA can kind of tell us about the camps that actually ran this summer, what went well, what didn't, and what kind of recommendations are coming out from the American Camp Association, the YMCA, and the National Environmental Health and Safety Boards, as they're talking about what does programming look like for minors. So it's not just camps, it's programs, it's youth activities. So Tim, could you come on screen, introduce yourself, and share your knowledge?
So I'm very excited to be here today. So thank you all for having me. My name is Tim Huckton, and I was working for the American Camp Association up until Friday of last week. And so I actually started a new role this week as the president and CEO of Mo Ranch, which is a retreat and conference center in Texas. And it's actually where I started my camping career 15, 20 years ago. So quite excited to be back at Mo Ranch as well. The things that we want to really kind of talk about today is understanding what kind of happened this last year with camps and programs across the entire country. And as you all know, a lot of things kind of happened and changed. And the big things were that everything pivoted, and hearing that term pivot over and over and over again is a really big one. So essentially what ACA did very early in this process was realizing that camps and conference centers and youth programs were going to need resources as fast as they possibly could to get them prepared for what was coming up this summer. Whether they were going to run this summer, whether they weren't going to run this summer, and how we could help them out as much as we could. So the American Camp Association very quickly, back in March, partnered with Environmental Health and Engineering, which is a health engineering consulting firm in Boston, Massachusetts. And we came up with a plan to essentially start to figure out how to survey the entire country, let them know what was going on, give them resources and tools that they were going to need, and really be able to use those. So before we start talking about the resources that we came up for specifically for COVID, I want to talk a little bit about the programs themselves, about camps. So ACA is a membership organization, and we essentially have 3,100 camps that are members of ACA across the entire country. The camping industry as a whole is a $3.6 billion industry. And over the summer, over 1 million individual seasonal staff are hired every single year to come and work at summer camps. And that serves 10.5 million campers every single year. And so it's important to know what that national reach is, because that national reach changed a little bit this last summer, and the mindset that when we started doing things, we realized that camp was going to change. So things there was when we started working with all of our camps this summer, we started calling every single one of our camps and trying to figure out if they were going to run this summer, if they weren't going to run this summer, how they were planning on doing things, what they were planning on doing, and trying to get an idea of things. Now, every single state was different. Some states were running completely full out and didn't have any problems at all. So I'm in Texas, and so Texas is one of those states that I tell people all the time is trying to race to the bottom of this heap. And we opened up everything very quickly. And while that's good in some ways, it also has some challenges as well. And so in Texas, we had about 70% of the camp programs run their program this summer. Which was a little bit different than what the rest of the country did. So 70% in Texas ran. But then we have other states like Massachusetts or New York or California that they completely shut down, and they didn't allow any youth programming whatsoever to happen. And so when ACA learned early that this was going to be an issue, we started calling every single one of our camps, asking what their plans are and how we could help them and what we could do to support them as much as we could. When we did this, we ended up finding out that 70% of the camps across the country were choosing not to run, or were being told that they were not allowed to run. So again, that's a very important distinction, is there was a lot of camps in a lot of states that they said they would have run based upon information and tools and resources, things along those lines they could have used. But at the same time, they weren't going to be able to because their state government was telling them they couldn't do this. So 70% across the camps weren't running. So if we know that 10.5 million kids get served by camp programs every single year, right, then we now know that, and this is just in our ACA camps, that if 70% of those camps didn't run and operate this summer, that 70% of those kids did not get a chance to attend a summer camp program. And the things that summer camp programs are really great for, whether you are a commuter camp, a day camp, a residential program, anything like that, camp is fantastic at building resiliency and building these 21st century learning skills. And so the speaker before talked a lot about resiliency, which is fantastic. And so resiliency is huge, right? There's three things that are really helpful for building resiliency. Really great role models. And so building that authentic relationship, okay? Skill building, okay, and doing the skill building in a positive setting, and then having positive experiences. And that's what your camp and your youth programs work on a lot, is being able to build resiliency through in-person relationships, having the ability to build skills as they're there, and then having positive experiences. And so we had kids this year that weren't able to do that because they weren't able to go to camp. My kids were lucky that they actually got to go to camp this year. They were a little bit upset at one point in time that their camp experience got cut from a 3-week camp experience down to a week of camp experience until I explained to them that millions of kids didn't get a chance to go to camp, and that how lucky my kids were that they still got a chance to go. And so that kind of put it in perspective for them. So the camps that did run had some new challenges. And so part of the challenge was and first off, I guess I would say that I wouldn't fault any camp or any program for deciding to run camps last year. And I wouldn't fault any program for deciding not to run. I think that camps and camp directors, program administrators, campus administrators, they had a tough decision last year to make based upon incomplete information. Right? At the time that everything was coming out and people were having to make their decisions, the information was not fantastic. We didn't know enough about the virus at that point in time to know whether it was safe or not safe. And so camps decided to run, and we're going to go ahead and do this. Camps also decided not to run. The camps that ran, we know that about 1,000 residential camp programs ran last summer. And out of that, about 10%, so about 75 to 100 of those camps, ended up having some type of issue with COVID. Now, an issue could mean that they had one case of COVID. It could also mean that they had an outbreak of COVID that was more than 5 cases of COVID, whether that be staff or camper. And so we know that 90% of the camps that ran didn't have any issues or problems at all. So I'm going to talk a little bit about the field guide and what we kind of came up with, and we'll talk about this layers of safety lasagna, if you would. So ACA, when we started putting this together, we partnered with EH&E again, and EH&E immediately said, what we need to do is we need to come up with a field guide to help camps and program administrators know what they can do to help mitigate the risk, what they can do to keep their campers and their staff safe, as well as show them some of the challenges that may happen. And so ACA actually has a field guide, and it's being updated regularly. When we originally partnered with EH&E, we planned on keeping them through August of 2020, but because this is still a very dynamic situation, we've kept this going for much, much longer. And actually, at this point in time, ACA is still planning on keeping them on the partnership with us through the end of 2021, I believe in October. So we're going to see regular updates to this field guide book. So there is a multi-chapter field guide book that's posted on the ACA website. We made this resource available and free to everyone. So you do not have to be a member of the American Camp Association to be able to access this resource. And normally with an association such as us, we'd put our best tools behind the paywall so that you'd have to be a member. But we realized early that camps needed this information, and they were going to be taking a huge financial hit if they weren't able to run, or if they did run, seeing a huge decrease in their camp numbers as well. So we wanted to make this resource available for everybody. So this tool is on the ACA website, so it's acacamps.org, and on the top of the website page is a little tab that says COVID-19 resources. And the best resource in there is definitely the guidebook, and so it's the field guidebook. This goes over everything from check-in, check-out, transportation. It talks about the PPE loan, or not the PPE, the PPE, so the personal protective equipment, not the PPP. And it talks a lot about the types of equipment that you would need to run your camp safely. So what we say in this is that camps can decide what they want to implement and what they don't want to implement into their programs. It's really up to you. There's nothing stating in our book that's written into it by law, right? Each county and each state will decide how they're going to run, and they'll be able to decide what's going to be required by law for you. But this is a really great resource, and we shared this with every health department across the entire country. So all the way down to county health officials, we've shared this with them, so they get a chance to see this. The more you put in place to protect your kids and your staff, the better, right? So if you want to think about this as a lasagna, right? If we have one layer of lasagna, you got noodles, you got sauce, you got meat, you got cheese, right? It's probably not bad, but it's not a great lasagna. So it's good, but it could be better. So every single layer that you put in for safety and health in your camp programs is going to add to that layer of safety lasagna. Right? So if the first layer is every single camper that comes, we're going to give them hand sanitizer options and be able to wash their hands and sanitize their hands regularly throughout the course of the day. That is a layer of safety. The next one could be that we're going to require everybody to wear a mask all day, every single day while they're in our program. So that's a second layer. Right? The third layer could be that we're going to do some screening ahead of time. And so prior to our in-person gathering, we're going to have the parents and the campers start to do 14 days of screening every single day for 14 days, that they have to fill this document out, and then they have to get this thing signed and notarized or whatever they decide they might end up doing. But they're going to bring this document to camp stating that this is my camper's health, and they're checking for all the symptoms of COVID. They're checking fevers. They're checking anything they possibly can. And it's helping because it's another layer. Is it a foolproof? No, it's not by any means, right? But it's just another layer in the system. And then on day of check-in, then you're doing another layer by checking temperatures, by doing a health screen in person, just to make sure that nobody's bringing this in. And so every single layer that you put in place makes your camp have the opportunity to fight this a little bit easier. Right. We also know that inside of this, no matter how many layers of safety lasagna you put together, there's a chance that you're still going to end up with COVID in your programs. The same way that schools, there's no way they're going to keep COVID out of a school. And so really, it's what does my response plan look like after I have COVID on my camp? Okay. And every single camp is going to have a different response plan about things that they think are important. All right, so the first one could be that we are going to shut camp down, and we had a case of COVID, so we're going to shut camp down, send everybody home. We'll do contact tracing, let all the parents know, and we're going to deep clean the camp and the program areas, and then in 10 to 14 days, we'll open camp back up. And that is a legitimate option. You can do that if you wanted to. There's also camps, though, that decided what they would do is put the kids into cohorts. Small groups that they kept that group together the entire time, minimized interaction with any other group at any point, and they would keep that to themselves and they wouldn't do anything else. And so they would keep that so that if they did end up with a case of COVID in, we'll say, a group of 10-year-olds in a residential setting, they were able to take that group of 10-year-olds and kind of run a shadow camp almost with, they're still doing camp activities, but they are doing things alone and together, and they are not necessarily going to have to go home. Now, a camper that's sick with COVID, they did go home in almost every single case. And so parents were sending or getting their camper home. But the kids that had just had an interaction with them, they would keep them until they started showing signs or symptoms. They would keep them that way. So however camps ended up doing it, every camp had a little bit of a different strategy about what they were going to do and how they were going to do it. But a lot of camps decided, you know what? Halfway through the summer, this is a lot more work than we thought we were going to be able to do. And so we realized that we can't keep up with this anymore. And so we are going to go ahead and close our camps down for the summer. So there were a number of camps that did originally say they were going to run camp, but then based upon how COVID kept expanding in their communities or in their camp community, they decided that what they would need to do would play it safe and just decide to close their camp programs down. The other part of this is that even if you were deciding to run your camp programs last summer, the market was really going to kind of limit itself as far as the number of campers you typically had coming to your camps. right? We know that camps that did run were running at 50 to 70% of their camp capacity. Some of those camps were deciding that they were going to run at lower capacity very specifically because they knew that they needed to have physical distancing, they needed to have protocols in place, and this was the best way to do that by having a smaller staff or a smaller camper footprint. Others didn't limit their numbers, but the market themselves limited. Parents didn't necessarily send their kids to camp because they didn't want their kids to go to camp over the course of this summer. This was also a year that we didn't see a whole lot of first-year campers attending camp programs, because if you're going to send your child to camp for the first time, which is already a big and scary thing to begin with, you're probably not really wanting to do that in the middle of a global pandemic. And so we saw parents that decided not to send their kids as the first-year campers to camp this summer. So the camps that ran would have extra expenses because they would have to take care of things, such as making sure they had hand sanitizer or gloves, masks for every single camper or staff, and how they would handle that. One of the best ways that I saw a camp that did the mask thing was they said everybody wears a mask when we're in public areas. When you're in your bunk, then you don't have to wear a mask. But otherwise, you were wearing a mask pretty much at all times, other than eating as well. And what they would do with that was they gave them these little lanyards that had the alligator clips. And so they could put their lanyard on, hang their mask down in front of them, and be able to have their mask, but take it off without dropping on the ground or losing it, things along those lines. And so every camp did different things to kind of help mitigate that as much as possible. Just a fun little tidbit. My daughter went to camp, and one of the great things about her going to camp this summer was it was hot, very, very hot, because this is Texas. And so, at any point in time, it could be 95 to 105 degrees, and we could have humidity that goes along with that. My daughter had to wear her mask every single day at camp. She never thought anything of it. They just did it. Right now, she got to school and all these kids were complaining about having to wear a mask. And she goes, "We're air conditioned inside. At camp, it wasn't air conditioned at all. And we had to wear a mask. You'll be fine." Right. So this is a thing that camps ended up teaching as well. I think for the most part, we will see more camps run this summer than they ran last year. Right. We've got things like the vaccine that are starting to come out now. We have a little bit better understanding of how we can handle this and what we can do. But there will be some things that camps will need to be aware of as they're running their camp programs this year. One, how can we make this as safe as we possibly can with our safety lasagna? So that's a big key piece of this is safety lasagna. Let's make this program as safe as we possibly can with all of our non-pharmaceutical interventions to keep our campers and our staff safe. The next part of that is the COVID-related trauma that's going to be coming with our campers when they come back on our campuses and to our camp programs. Right? The average number of hours that kids were spending on screen time before this pandemic for a 9 to 14-year-old was right in that neighborhood of about 6 hours. Now they're spending 8 to 9 hours every single day on a screen. So they're not having this in-person interaction anymore. So as one of the other speakers said, we're going to have to teach them how to have that interaction again. Right? So are you training your staff on how to teach your kids how to have interaction? When at the exact same time, your staff is probably also in that same mindset that they have not had that in-person interaction as well. So we're trying to figure out how we can train our staff as much as we can to help them with the social things, the interpersonal relationships, the communication, right? These soft skills that are very, very important for them in their development, but nobody's been practicing those for the last couple of months. The next piece of that is the other part of the COVID-related trauma, where we are going to see people who are coming to camp that abuse has gone up, right? And so they have not been able to get away from abusive situations. And so we expect that this year we'll see a number of increased disclosures of abuse while they're in camp programs, because this could be the first time that they're coming to an area where they're safe and they want to tell somebody about these things. So are you training your staff to be prepared for the fact that there is going to be an increase in this potentially? And you need to be able to help your campers and your staff understand this. What are you doing to help your staff mentally prepare for this and also be supported in this so that they know that they have all the support that they need so that mentally they're not going to get fried as well? And kind of the last piece of this preparation for this summer is you're going to need to overhire your staff. So one of the trends we've noticed over the last 18 months, or sorry, since last summer, was that camps that were running were overhiring staff, so that if they had staff members that ended up sick at any point in time, they could send that person either into quarantine or send them home, whatever that looked like for them, right? But they still had to have the right number of staff to meet the ratios that were either through accreditation or through their state laws that said they had to have certain levels of ratios there as well. So understanding that you will need to have additional staff, additional PPE. You're going to need to train your staff a whole lot more effectively this summer on interpersonal relationship skills, on identifying and understanding abuse, and how to handle that. And then also teaching them how to be great role models of interpersonal communication and skill sets like that. ACA's got a lot of resources for you, and so there's a ton of information on our ACA website. I know that Pradisha put a couple things in the chat box, and there's some other links up there. There's a lot of webinars talking about program development, a lot of help that's out there, and really anything we can do to kind of help you all out. ACA is here for you all as well. So I am no longer with ACA, but I am also available to you at any point in time. I'll put my information in the chat as well, so that if anybody needs to get a hold of me or wants to get a hold of me, you'll know how to get a hold of me. I'm happy to answer any questions for you. For the last 4 years with ACA, I've been a membership manager, but also specifically working with higher ed institutions and K through 12 schools that run youth programs. So I'm here to be a great resource as much as I possibly can for you.
So what I was going to say is that now we're going to do a breakout session, and this topic for you all to discuss will be: what preparation have you already started to do to return minors physically to campus? So like, for instance, one thing that I have done is made sure that our directors that are coordinating the PPE and the testing know that minors may return and that we need tests for them too. As many of you know, the new interim system policy 600 states that all that come physically onto our campus must be tested. So this would include minors too. And so what are some other preparations that you could see yourselves doing, and how are you anticipating those costs? So I would encourage you to discuss that in your group, and Tom will start breaking you out into groups. Then what will happen is you'll come back and you can share out to the group, and you can also ask additional questions to Tim.
New to this role of kind of centralizing our youth programs on campus. And one of the things our group talked about is having access to devices and internet. So it's, you know, you might think, okay, so we can just flip over to a virtual option if needed. Well, not if the youth that are participating do not have access to a device or internet, so it's not that easy. And so, and this, are you having trouble hearing me, Bernicia? Or oh, you're muted, I think.
No, it was my computer, not yours.
Oh, okay, great. And so, I mean, just considering that we, you know, that this is not, COVID's not going to just end, the vaccine isn't a miracle, and there are going to be more issues in the future. And so how can we figure out some more permanent solutions to some of the problems to make sure that our youth are having access to the programs if we have to go back into a virtual environment?
Thank you. Thank you. Someone posted in the group, we got caught off in a very important conversation about vaccination not being approved for minors. I feel that this needs a lot of attention. One thing that I have learned during this time, especially working at Madison and other places, Wisconsin itself is very much an anti-vaxxer kind of environment. You know, folks don't do vaccinations in general. So as we think about the future of the COVID vaccination, I think we're going to have to plan that many of our participants will not be vaccinated. And what will our plans include? And what I used to teach about planning programs is it was important that we documented 5 things: who's here, who's responsible, when, where, and why. The why is very important during this time, because you have to assess why you are taking this risk, because no matter what, programs during COVID is a risk. Also, who's here, who's responsible. you'll have to do much more thorough documentation of these interactions, and also document those who have or have not been vaccinated. So using HIPAA compliant forms and documents to actually trace and track all this will be very important during this time, because even 3 to 5 years from now, even if we have the vaccination, you will have many students that will not be vaccinated. We have had students get measles, mumps, rubella. We have had polio in camps. It is just something that happens because not everyone is vaccinated. So thank you for posing that question. And I think that you should continue that conversation with your campus. Right now, testing is mandatory. I guarantee that you will have parents that will refuse to have their youth tested, right? And so what is your plan for that? Does that mean that you're going to run a hybrid program and have some in person and some virtual? Because the policy, the system policy is you must be tested to physically be on campus. So those are all things to think about. Any other kind of questions and observations?
Yeah, I do. My name is Meki Aneke. I'm the advisor of the Upward Bound program at Wisconsin La Crosse. So our program deals with more of the high school populace as far as trying to get them streamlined to college. And we're lucky to kind of scramble to make a virtual program out of our typical travel outreach to the community, because the high schools that we reach out to in La Crosse and Monroe communities, some of the schools are not in the city of La Crosse, so we have to do some driving out. But because of COVID, of course, we can't, because each school had a different notion of opening or closing or hybrid. So we just had a hybrid program, and we have had positive feedback. So I think what we're doing for the program as far as supporting it virtually too was having sure that each student, when they joined the program, just got aside an iPad. If you had issues with connectivity being in the rural parts of La Crosse and Monroe counties, you got a hotspot too. And with our virtual programming, I know, for example, we had a summer program where we did food around the world. So since our program is grant funded, having to provide the materials using USPS to the best of our ability to package these care packages and send them over has been godsend as far as to being able to reach them and keep them engaged. Now we're trying to account for optimistically the vaccine, and thanks, Joel, for that. As far as, you know, minors maybe getting vaccinated or not, those are questions that at least our program in particular cannot necessarily answer, but the UW system or the cross as far as the higher ups could. But for now, we're just assuming that we're still virtual for spring for sure. Summer is a real toss-up, just because even if we have a plan of attack, the only question I personally will have is, are we still following the local guidelines? Because that's to ultimately decide on how we move, if it's within the counties or even out of, as far as we come back on our quarantine. And also culturally too, we have a higher Hmong populace in our student body. So going back to, would the parents even want them to go test it, get the vaccine, or even just still be in the program? Those are still questions that we have and still trying to tackle with.
Thank you so much for sharing. We have about 3 minutes left. Does anyone have any questions for ACA, or just questions in general that they'd like to continue to pose? So I put in the link for where you all can find the resources. It has the field guide. And also we have a questionnaire that we will send out to you all, so you can let your campuses know when you're ready. So everything that's in the field guide is in a form, and you'll be able to upload if you have that communication plan. You'll be able to grade yourself and see if you have everything that you need to do this. And so when you go back to your pre-college liaisons and your campus leadership and say, hey, you know, I've looked at the field guide from ACA, I've looked at the CDC's checklist, and I think I can be about 85% compliant. And then allowing them to make decisions about you running in person, maybe for summer or even fall of next year. We don't think that the programs are just going to open up overnight. We don't think that, okay, you've had this meeting and now you can do spring programs in person. But we want to give you plenty of time to prepare. And that's what this is what do you need to prepare?
So, Pernisha, if you'll let me just say one thing real fast, and then I'll turn it back over to you. So, ACA does have a Camps on Campus conference coming up February 16 and 17 of this year. If you're a member of ACA, it's $40 to attend that, and it's going to be a 2-day event that talks a lot about all of these things. And so it's really, really great information as well. If you're a non-member, it's $80, but I'm going to tell you how to be a member here in a second. And the other part of that is if you have multiple people from your campus that want to attend, the first person's $40, and each additional person after that is $15. So you actually get a chance to save a whole lot of money on this conference. You can become an individual member of ACA for free for 1 year. If you just go to acacamps.org and just hover over the tab that says membership, you're going to join as an individual. You'll go in, enter all of your information in there. At the very end, it'll say choose your rate, and you all are educators, so you can choose the educator rate, which is $95. You're going to click on that, and then it's going to ask you to go check out. Right. And at the end, when you're checking out, you're going to put a promo code in there, and that's going to wipe that $95 off of your expense. And the promo code is TIM, and that's TIM, all capital letters, and that will get you in for 1 year of individual membership into ACA. If you reach out to ACA at that point in time and let them know what your role is with the university, they'll also add you to what we call our Camps on Campus group, to where you get emails, newsletters, and then resources that kind of help you out in running your programs. So thank you all so much for having me, and I will turn it back over to Pranisha and your group. So thank you all very much, everybody.